PIH is post-inflammatory hyperpigmentation, and most of this is not permanent because typically with acne scarring it tends to be more superficial on the skin, but it can cause a lot of stress for people because your skin still doesn't look even. It still doesn't have that beautiful skin look to it. Hyperpigmentation is the deposit of melanin or pigment due to stimulation of melanogenesis, which is the process where pigment is produced and duplicated in the skin. It's the end result of the immune system triggering inflammatory response, which triggers melanocyte activity to protect the skin. So melanin is there to protect the skin. PIH is the pigment deposited as a result of surface irritation, inflammation or abrasion of the epidermis, and it's dark or red spots left behind after acne lesions heal. It can be left behind not just from acne, but any type of dermatitis or psoriasis, eczema, bug bites, anything like that can certainly cause PIH to happen. It's very common among African, Asian, or Latino descent. It's much more common in the darker Fitzpatrick's types, typically Fitzpatrick 4 through 6, typically have higher pigment producers, and they typically tend to get more scarring than the lower Fitzpatrick's types. It can take months or years to fade, depending, again, on how severe it is or how deep it is in the skin. Brown discolorations is true post-inflammatory hyperpigmentation. This is where there's melanin deposits. This is where it's a result from the inflammation of the lesions, extractions, or excoriation. Again, more common in higher Fitzpatrick's types. And you can treat this with exfoliation and melanogenesis inhibitors, where we're inhibiting that melanogenesis activity from happening. When we see red discolorations, this is not technically post-inflammatory hyperpigmentation. This is rather a sign of persistent inflammation and that the skin is still healing. This is more common in the lighter skin, and we can treat this with anti-inflammatory and healing products. Redness can also take months to go away. Redness can also sometimes turn into brown discoloration. So if the client is prone to PIH or they're a higher Fitzpatrick skin type, then you want to also add melanogenesis inhibitors to their regimen as well. So how do we treat PIH and scars? Vitamin C is very, very powerful. Acne scars can be stubborn. They may need multiple different treatments to see results. So we might want to do kind of a combination of things here, but we know vitamin C certainly has very powerful skin lightening benefits to it. Chemical peels can certainly benefit the skin. Brightening agents, things like kojic acid, licorice root, azelaic acid, they're all known to reduce pigment. Tyrosinase or melanin suppressant agents are also effective. Hydroquinone, which is not a bleaching agent, but it is a melanin suppressant. We know that we can typically get about a 2% HQ from estheticians and about a 4% from dermatologists. It's not something you want to stay on for any extensive amount of time, but it's very, very effective in treating pigment. Laser treatments, in laser resurfacing, the laser beam basically destroys the outer layer of the skin and heats the underlying surface. So as the wound heals, new skin forms. And after several treatments, the scars certainly can become less noticeable. Dermabrasion, again, removing the top layer of the skin. Surgery can also help, and this is really where we're talking about more of those indented scars. You can do things where they actually cut out the individual scars if they're deep and then stitch it together. Or you can do some type of filler where they inject collagen or fat under the scar to actually fill or to stretch the skin so that those indented scars are less noticeable. Pigment will typically get worse before it gets better, and this is something that you want to inform your clients of because the pigment lays under the skin. So as it starts to work its way up to the surface of the skin, it typically gets darker. And then as those dead skin cells fall off is when we start to see the skin really lighten. So if they are working on getting their scarring under control, you want to let them know this from the beginning, because if they are trying to lighten it and they see it getting darker, they might go, what the heck is this lady talking about? It's getting worse, it's not getting better, and then they stop seeing you and they stop doing the treatment that you've prescribed for them. So it's important to tell them ahead of time. It might get worse, or it typically gets worse before it gets better. So as you're seeing it get worse, know that what we're doing is working, and just continue, and you're going to start to see really nice results very soon. So to prevent and control post-inflammatory hyperpigmentation, number one, don't pick at your lesions. That's probably the best thing that we can do, that we really have a lot of control over. Properly extract the lesion if you have to. Certainly we want to make sure that we're doing it professionally. We want to make sure that we're wearing finger cots or some type of cotton around our finger so that it's not tearing at the skin. We want to make sure that we're gently exfoliating the skin so that we don't cause any more trauma to the skin. Increase the cell turnover. We want to use some type of tyrosinase or melanogenesis inhibitors. Things like vitamin A derivatives are great for cell turnover. They bring healthy skin cells to the surface of the skin. Things like ascorbic acid help to prevent melanin. Lactic acid, that also helps to suppress the formation of tyrosinase. We also want to make sure that we are protecting our skin against UV rays and inflammatory stimulants, so we want to make sure that we're using a broad spectrum SPF of at least 15 or higher every day, not just in the summer, not just when we're out in the sun, but every day, all year long. Sun can certainly make the dark spots darker. And we want to make sure that we're treating acne properly so that we avoid future lesions to begin with. So as far as what cures can do, we certainly have several different professional treatments that we can use on our clients. As far as the facial goes, we want to make sure that we cleanse with a gentle or acne-appropriate cleanser. We want to make sure that we're toning the skin. We want to make sure that we're exfoliating with something non-abrasive or some type of enzyme peel, right? Things like our algae depore cleanser or the enzymatic peel that we have would certainly be very, very appropriate. We want to make sure that when we're exfoliating, we're not using brushes or scrubs that are too irritating because we want to help to reduce inflammation. We don't want to make the inflammation worse. We can steam with a disincrustation solution, which would be our pore balancing moisturizer, and we can certainly use the ozone in our steam at this point, right, to help kill the bacteria that's laying under the skin. We can also use galvanic current with the disincrustation to help soften the follicles and to help make our extractions easier. When we extract, again, wrap your fingers in cotton. We want to treat with a serum. We can also use high frequency at this point with the serums. Some type of light acupressure massage or would help. We want to make sure that we're not doing any type of effleurage massage or anything that will involve any type of friction on the skin. Apply a mask, anything that will help to absorb the oil. We also want to make sure that we're applying a light moisturizer. So we know that we have two different facials that we can use. We have our dry acne facial as well as our oily acne facial. We talked about both of these conditions, right, where people have that dry, oily skin, or some people just have oily skin. We're going to use different products for each. We're going to change out the cleanser first and foremost, right? Dry acne, we're going to use a gentle cleanser. Oily acne, we're going to use the foaming cleanser. You might want to change in or out your serums or your moisturizer at the end of the facial as well. We can also do a facial, something like the seeing is believing. We talked about vitamin C, about how healing it is to the skin, how it helps to heal the lesions. It also helps to lighten any type of scarring that might happen. This is a 30-minute treatment that's focusing on really, really infusing vitamin C very deeply into the skin, where we're using it with our galvanic current to really help it penetrate very, very deep. So we are still cleansing the skin and toning using the algae depore cleanser. This, we are not doing any extractions in this facial. Again, it's a 30-minute treatment, really just about helping to heal the skin and really calm the skin down and really, really pump that vitamin C into it. Some of the products that we are going to be using throughout our treatments, we'll use things like anti-stress remedies, right? We talked about how stress affects the skin. So it's a no-brainer that we would start our treatment off with something to help reduce the stress, help calm and relax and loosen those tightened muscles and pores. So we can start by using a breathing inhalation with the anti-stress remedy. The gentle cleansing milk is a great option if you have someone that has dry acne skin, if you have someone that has severe inflammation in their skin. This will clean the skin. It will also help to calm everything down, also add hydration to the skin. We have foaming cleansing gel, which we know has the algae extracts in it. It also has allantoin, so it's a very calming, soothing, healing cleanser. And at the same time, it really does an unbelievable job of really, really cleansing the skin and really leaving you feel very, very clean. C-Mist Toner is our cleanser in the line. It does help to balance the skin's pH. It is mineral rich. It helps to remove any remaining traces of oil, dirt, and makeup. We do have the seaweeds in here. Again, the algae extract, the Fucus fasciculosus. We also have the lactic acid in here, which does help to exfoliate and moisturize. And we have the ylang-ylang, which helps to balance and calm down the skin. Our Algae Deep Pore Cleanser, we know one of our best-selling products. This is an excellent option to use as your exfoliator for people that have acneic skin because there's no beads, there's no grains, it's not abrasive by any means. It's actually a creamy consistency. And the way that you'll use this is on your fingertips with a little bit of water. You're going to start to rub it together. You'll start to see a sudsing action happening, and we'll apply it to the skin. Work in circular motions for about 2 minutes and then remove it. We know that this works with that Laminaria digitata, that brown seaweed, swells up the dead skin cells to 100 times their size so that they slough off very, very easily. It's very purging on the skin. There's eucalyptus, there's almond oil in here. It's a very, very effective product. This is something that you should use about 2 to 3 times a week. A different technique that we can also use with the Algae Deep Pore Cleanser is a gommage. And this is where we are focusing on one area at a time, and we're taking a little bit of the Algae Deep Pore Cleanser and basically dotting it on the area of concern. Make sure that your fingertips are very, very clean. And with your clean, dry fingertips, you're going to lightly rub that Algae Deep Pore Cleanser back and forth on that area of concern. And you'll notice within about a minute or two that it starts to kind of leave behind little like eraser flakings. You know, when you rub an eraser on a piece of paper and it leaves those eraser flakings behind, that's what this will look like. And it's helping to really exfoliate the skin in that area and really help to purge whatever's underneath the skin. So use this on areas of concern. We can also use our enzymatic peel. And this, again, non-abrasive. There's no beads. There's no grains. This is a professional enzymatic peel that can be done as an add-on to any facial that we have or any body treatment as well. This would be great for any acne wherever it is on the body. And in here we're using the papain, which is the enzyme from papaya. Helps to dissolve the keratin. It's a gentle exfoliant. We also have sweet almond seed meal in here, which is also another exfoliant. Hyaluronic acid, we're adding moisture to the skin, hydration to the skin. There's also aloe in here, which is very healing, has nice anti-inflammatory properties. So it does a really wonderful job of helping to get those top layers of dead skin cells off so that we can now start to extract the way that we need to. It's adding the hydration, so those impactions will get softer and allow us to extract them a lot easier. The enzymatic peel, we know, always has to be used with moist heat, so if we're using this on the face, we want to make sure that we apply a very thin layer on clean skin. Use it under steam for about 7 to 10 minutes to really activate the product. If we're using this on the body, again, we need to use it with warm, moist heat, so we're going to apply it very thin on the body and then wrap the body in Mylar and use the heat from the body to activate this. And then once you're done, you're going to remove it completely and move on with your next steps. Pore Balancing Moisturizer is our disincrustation solution. So we're going to use this under steam for about 7 to 10 minutes. We have the shea butter in here, grapefruit seed extract, citrus acid, Fucus fasciculosus. Again, those seaweeds, very powerful in treating acne. This does provide antibacterial protection. It does help to release the impurities trapped within the skin. And it does a really nice job of restoring the skin's pH. Our blemish serum is great for anybody with acne, congested, or oily skin. This is also something that we can use to spot treat. We talked about tea tree oil before. We talked about 5% tea tree oil is just as effective as 5% BPO. So it's a very, very effective product. It's very antiseptic, very antimicrobial. We have cage put, lavender, juniper. So we are not only concerned about killing the bacteria in the skin, but also calming any inflammation that might be happening and really helping to heal the lesions that we're seeing much faster. So if you're using this on the whole face, about 5 drops or so, work that in and apply the activator on over it. Or you can spot treat anywhere where you're getting the blemishes, and always use the activator over it. Remember, the activator is just seawater and phytoplankton. It's going to help drive the serum deeper into the skin. The seawater and the phytoplankton have very high levels of vitamins, minerals, trace elements, and antioxidants. So very, very healing to the skin, very hydrating to the skin. It helps to nourish the skin. So very beneficial to use the activator with the serum. Serum vitamin C therapy we talked about already. This has a 10% L-ascorbic acid. It's a very powerful skin lightener, very powerful antioxidant. In here we also have mixogenol, which is a blend of over 150 botanical properties, grapeseed extract, which again, antioxidant. This product does a really nice job of helping to reduce any hyperpigmentation and freckling. It helps to have a clarifying effect on acne-prone skin. And the 10% L-ascorbic acid is very, very effective. I think I've mentioned this in other classes, but it's been shown that about 5% L-ascorbic acid is all that's needed to really show improvement on the skin. So by having 10% in there, we have a really nice amount of L-ascorbic acid in this product. It's a very powerful product. Our anti-acne mask is great for oily skin or blemish-prone skin. We have, again, the seaweeds in here. We also have camphor in here, spirea extract, eucalyptus. It does a nice job of helping to absorb excess oils, reduce inflammation. It's very purifying and detoxifying. When we're using this during the facial, apply a very thin layer. Leave it on for 10, 12 minutes and wipe it all off. If somebody's using this at home, they can put a mask on their skin 2 to 3 times a week. You can spot treat with this. So there's different ways that you can use this. And you can use this on the face or on the body, wherever you have the breakouts. If somebody has very inflamed acne and we're more concerned with calming the skin down, then soothing mask would be more appropriate. We do have the linden extract, vitamin E, wheat germ oil, and calendula. So again, load it with antioxidants, but very healing and soothing and nice anti-inflammatory properties here to really help calm any tender areas or any inflammation. Re-elasticizing mask is fantastic for anybody that has acne. Again, the seaweeds. It's the seaweeds. They're just so powerful. They are so healing. And when we use this mask, we're going to customize it with a serum. So whether we need to use the blemish serum or the sensitive skin serum, depending on the skin, you can customize this mask to really get even more benefit out of it. And I'll tell you, when I do facials and I do extractions on my acne clients, no matter what mask I use, whether it's the anti-acne, the soothing, or the re-elasticizing mask, one thing my clients always say to me is, I can't believe how great my skin looks after you did all those extractions, because I love cleaning out the skin. I love when people come to me with acne and I clean it out. I love that nice before and after. You see them when they come in and you see the difference immediately when they leave. And when you do those extractions, a lot of people get really inflamed afterwards. But these masks really help to calm the skin down really, really nicely. So re-elasticizing mask comes in a powdered form. We're going to mix this with half a cup of cold water. The cold will also help to reduce the inflammation on the skin. This is something that we can go right over the eyes or the lips and do a nice eye and lip treatment at the same time. We can also use this on the body. So if somebody is coming to us for treatment for chest acne or back acne or anything like that, we can certainly use this on those areas as well. Purifying Blemish Moisturizer. You guys should all have been in on the class introducing this. Purifying Blemish Moisturizer is a new moisturizer that we have that is ideal for oily, blemished, or enlarged pores. In here we have the Alp Sebum, which helps to reduce pore size. So if you're someone that has enlarged pores, this is great for you. It's an anti-inflammatory. It's non-comedogenic. People that have acne still need to make sure that they have proper hydration in their skin, and a lot of times they steer away from moisturizers because they feel like it's going to add oil to their skin or it's going to make them break out, but that's not the case if you're using the right moisturizer that's intended for people that have acneic or oily skin. The idea is that we want to make sure that we're adding the hydration in without causing further breakouts. The willow bark extract helps to fight inflammation. It helps to decongest the clogged pores because there's high levels of salicylic acid in there. So it's helping to exfoliate from within the cells. We also have lactic acid, which is alpha hydroxy acid. It's very, it helps to smooth and soften the skin's texture. So we know with acneic clients, they have a very bumpy texture to their skin. This helps to exfoliate the dead skin cells, increase cell turnover, and stimulate collagen production. Glycolic acid is very, very effective when treating acne because it has such a small molecular size that it penetrates very deeply, and it's a really great exfoliator for the skin. Salicylic acid helps to reduce blemishes and blackheads, but it also has a nice, the lactic acid helps to even out the skin tone as well. So it will also help with the acne scarring that people are experiencing. This is also paraben-free, just so that you're aware. Now, when people come to us for body acne or systemic acne, there's a couple different things that we can do for them as well. One of them being the enzymatic peel that we talked about earlier, right? And we know enzymatic peel, we're going to apply it to the skin, very thin layer. When we use it on the body, we need the warm, moist heat as well. We'll apply it with the Mylar, leave it on for about 20 minutes or so, and remove it. And again, we're just helping to do a nice professional exfoliation treatment without causing irritation. We're not using anything abrasive. We're using the enzymes from the papain and the almond seed meal to really help to exfoliate the skin, hyaluronic acid to add in the moisture and the hydration, and the aloe juice to help bring down inflammation. Something like the detoxifying body wrap is very beneficial because we're using a couple different things here. First of all, we're using the slimming gel, which is going to help to release toxins from the body. And we talked about how toxins can accumulate in the body and then be eliminated through the skin and show an increase in things like acne and eczema. So when we use the slimming gel, we're going to apply this only to areas of concern. We're not applying this to the entire body, but we're basically helping to widen the blood vessels with the methylnicotinate. And then the IV extract helps to really flush the system of those toxins or excess water. The Laminaria digitata also has a very detoxifying effect on the skin. So releasing toxins is really essential when we're dealing with acne. And then on top of that, we're going to apply the detoxifying body pack. And again, we have all three seaweeds in here, the Lithophanium calcareum, the Laminaria digitata, as well as the Fucus fasciculosus. We also have Melissa in here, which helps to stimulate circulation. So again, when we're laying this on top of the slimming gel, we're just helping to really release those toxins from the body. As far as retail and what we can send our clients home with, we have a lot to offer here. And as far as what we're going to offer them when they have breakouts on their face, we can also use a lot of these products on their body. Things like gentle cleansing milk, foaming cleansing gel, C-Mist toner, algae deport cleanser, blemish serum, serum vitamin C therapy, pore balancing moisturizer, purifying blemish moisturizer, soothing mask, anti-acne mask, or the acne cures to go would also be great, just to be able to get 3 products in the smaller sizes into their hands without them having to spend so much money or without them having to buy the retail size products without them knowing if they really like it or not. So we have a lot of options here as far as what we can send them home with retail. If they're experiencing acne on their body, we can send them home with the hydrating body buffer, right? Not only does this cleanse the skin, but there's very small beads, very gentle beads in there that will help to gently exfoliate the skin. The slimming gel would be great for them to go home with. Something like the Stress Relief Sea Bath, where they can put a couple tablespoons of the Stress Relief Sea Bath into the bathtub in some lukewarm water and just soak for 20 minutes and just allow yourself some time to de-stress and allow yourself to really kind of loosen up those muscles and the pores and allow things to just be released and flow the way that they're supposed to. Exfoliating gloves are also beneficial. Now, you just want to make sure that you're not using exfoliating gloves over real active acne, but you can use this on other areas of your body to help stimulate the blood circulation as well as the lymphatic circulation to, again, help release toxins from the body and bring more oxygen to different areas. So we can use the face products on the body, but these are body products that we can use as well, and these are some that we can use in addition to the face products. So as with anything, we certainly recommend a very multi-dimensional approach to your skincare. Maintaining a healthy lifestyle, a home care regimen, healthy diet, nutritional supplements, and professional acne treatments will result in healthier, more radiant skin. And just going back to why we chose this profession, for me, and I'm sure for a lot of you, looking good and feeling good go hand in hand. Acne sufferers experience very low self-esteem and confidence. They may withdraw socially and experience depression. When most acne is treated correctly, you can expect outstanding results. Treating this condition can truly be one of the most rewarding experiences for an esthetician. I know for me, it has been. I hope it has been for you. And I hope that you've gotten some really great information from this class. I hope you've learned something new that you can take away with you or that you can educate your clients on. And I hope that it helps you to go further in your career and really help to give some really beneficial results to your clients. If you have any questions, feel free to email me, call me. I look forward to hearing from you. Thanks for joining us today, and we hope to have you on future webinars. Thanks a lot, and take care.